Promise, and now food dyes could be on the chopping block.
Plus, the FDA wants Novavax to do a new clinical trial on its COVID-19 vaccine before new shots are available. Dr. Jeff Potoff joins us for our weekly health headlines. Thanks so much for joining us.
Hey guys, how are you?
You're doing well. How are you?
I'm good.
Well, let's start with the RFK campaign promise. Like what, 8 food dyes? Are they harmful, and how harmful can they be?
Yeah, I think these 8 food dyes, they all have a petroleum base. And on the pro side, when you look at benefits of something in our food, this is where these dyes tend to lose out. There's absolutely no nutritional value. There's no health benefit. So there's not a lot of upside. Now on the downside, it's not super strong. If you give these dyes to, say, rats at very high concentrations, they might be able to cause cancer, probably not at the concentrations that they're in food. The other thing that maybe has more evidence behind it is kids who are maybe already susceptible to hyperactivity. So say kids who maybe have underlying ADHD, ingesting these food dyes can make them even a little bit more hyper. So not a lot of good reasons to keep them around. The reasons to get rid of them, maybe they're there. So there are other countries that have done this. Some in Europe, France have banned these petroleum-based dyes.
And tell me, how realistic, I mean, they're in everything. How realistic is it to, take them out? And what will that look like? Are my Twizzlers going to taste any different? Or
Yeah, it's a good question. I mean, these things are in thousands of products. I don't know about taste. They might not taste different, but they might not look so great. Like your Skittles might not be so bright and vibrant. That yellow M&M maybe won't be quite so yellow. That would be something that we'd have to get used to. They might not look as appealing as they do right now.
Didn't Kraft, like several years ago, kind of tweak its recipe to use like turmeric to make the yellow color versus a...
Yeah, other manufacturers have done this where they've kind of like auto-selected to get away from these things. And clearly they're selling these products in countries that don't allow for these dyes. So it's possible to do it, but they just probably don't look quite as appealing to our kids as they're walking by.
Yeah. Well, on the vaccine front, the FDA wants Novavax to do a new clinical trial before the new round of shots is approved. I read that the company says it believes that its vaccine is approvable, but it's worried about some delays. So what's at stake here?
Yeah, I think what Novavax is trying to do is they're trying to get their vaccine to market like Pfizer and Moderna has theirs. And it works a little bit different. It's a protein-based. I think where the hang-up is typically when vaccines, say for influenza or COVID, get approved, they're approved on whether the vaccine is safe and effective. But then every year, like for flu, there's an update to like what we're covering. What the FDA may be asking is like, well, we want you to prove that the update's effective. That can get tricky because that means at the start of flu season, you'd have to put this study together, test thousands of people, prove that it's effective, then get it out to the masses. It might make it difficult to actually make it available. So I think there'll be a little bit more back and forth between the FDA and Novavax on how exactly this is going to work.
And how could this affect, if this will affect any other type of vaccines on the market?
Yeah, I think it's hard to say. I mean, with these vaccines that get these annual updates, it would be challenging for any vaccine maker to prove that the vaccine works because they couldn't really prove it until the respiratory season starts. The other thing is these are not static things. As we saw with COVID, the mutations happen. Same with flu. Your study that completed last week may not be all that applicable if something just mutated and now it's a little bit different. So I think a lot of manufacturers are really leaning on like our vaccine is safe, it's effective. Tweaking these little things that pick which targets we're looking at as far as the strains of viruses probably don't meaningfully impact the safety or effectiveness of the vaccine.
So we'll have to wait and see how this turns out.
More to come.
All right, Dr. Potoff, always good to see you. Thanks for being on with us. And coming up, we have Jacob's first warn forecast.
And later,